have one last question related to pregnant women with IBD for Dr. Graff. And so Dr. Graff, how can pregnant women and newborns cope in the time of the pandemic? So both Dr. Pham Huy and Dr. CHEO sort of mentioned, don't have visitors, don't have the grandparents over, don't have people coming into the home to see the baby. That's really hard, obviously, for a new mom and a new father as well, right? You want to share the joy of having a new baby. So it can be very stressful and very sort of anxiety provoking as well. How do you recommend pregnant women and new moms cope with this?
Yes, there's been some very good advice by our colleagues just a few moments ago around the ways to stay safe and to stay healthy and to stay protected. But so much of that involves being away from all the natural supports you would have in pregnancy and when you have a new baby. So it's an exciting time and it's an anxiety-provoking time without a pandemic, and you put a pandemic on top of that, and the anxiety and the fear can really ramp up. I think one of the ways to think about it is those would be normal reactions in what's very much an abnormal situation. So thinking about the comment I'd made earlier around psychological closeness, this really is a time to connect in any ways that you can. Virtually is mostly what it's going to be, but you know, the grandparents and aunts and uncles and nieces and nephews are going to want to see that new baby, so help them to see that new baby. They just can't come over to visit. Send pictures, link up by Skype, have little mini 5-minute visits every day to be able to see what the baby's doing now and how you're doing. Another aspect to think about is what would you do without a pandemic, without being in the middle of a pandemic, is often connecting with other families with, you know, a new baby, or connecting with other pregnant moms and just being able to compare notes, share a little bit about fears and worries and how that's going. So the staying connected virtually is one key piece. Another key piece is aiming to stay in the now, because our fears and worries are going to really, really build up through this time. Where there's some good reassuring information that so far what we know is that you know, children do okay. We think so far right now, babies may do okay, but being able to, but of course our minds get going with what if I get sick? What if my partner gets sick? What if the baby gets sick? That's all looking in the future. So aiming to stay in right now. Right now, I'm home with few distractions because we can't go anywhere. And so really aiming to enjoy that time that you're home, and keep bringing those worries and fears back to, but we're okay right now. We're doing all of the steps that we know how to do to protect, to look after, you know, your health, and be able to just focus on enjoying the baby and you know, building from those steps. Sometimes you have to get very specific about talking back to those worries. And so that's where the staying informed is quite helpful, because you may, you know, hear things on social media about this or that. Coming into a webinar like this, where people are professionals are staying connected with the up-to-the-minute information about how this is all going to unfold and how this might affect you and your baby, helps to talk back to those worries that can really then have you not sleeping well and not eating well, which then again starts to undermine your health. So stay connected virtually, stay in the now, focus on now, not 2 weeks from now or 6 months from now, and stay informed.
Great, thanks so much.